I think the fact that there's just a large volume of information that gets shared with you in such a short period of time, it's very challenging. At times it's difficult, but I think it's also very rewarding to be able to get that kind of information in a short amount of time and have such good instructors and facilitators be able to share that information with you. Well, I think that relates back to one of the benefits of the program, and that's the volume of information and some of the expectations that you're given early on in the program. 27 months after starting this program, you're going to be in a field with a supervising physician who's going to expect you to make some pretty important decisions and to do them pretty quickly. And that's stressful, but it's also very rewarding in that you're given the opportunity to help people on a level that is kind of uncommon, and that's very rewarding. The part of the simulation process I enjoyed most was probably the part that was the most challenging, which was being put on the spot and being presented with your weaknesses so quickly. Another aspect of it that I thought was important was being able to get our hands on a lot of the equipment. You go through so much that's didactic that when you're actually given the opportunity to touch equipment, interact with a patient, even though it's a simulated patient, it makes you think about the things you don't know and the things you aren't comfortable with. So those two things. I think pointing out a lot of my weaknesses has been the biggest thing, but also finding out how to facilitate in a group of people and how to do it effectively so that once you see this again, possibly in an emergency department, which is my specialty, how to do that in a calm manner so that you can work effectively with a group of people and maintain control. Well, I think this is an example of the cutting edge that St. Francis always strives for. This is a great benefit for the students in that they're able to practice a lot of the skills that they typically don't get to practice until they're with a supervising physician or with a preceptor, and that puts it head and shoulders above other schools in the area. This lab gives you the opportunity to begin practicing nursing or practicing medicine long before you have to be worried about the art of practicing medicine. And it's nice to be in a controlled environment where you can be uncomfortable and you can make mistakes, but know that you're not really going to hurt anybody. My participation in a Code Blue simulation with some of my classmates. I think for some of the reasons I mentioned earlier, in that being able to facilitate a very stressful situation with a group of people and finding out what your strengths and weaknesses are and making sure that you can get the job done effectively.